Hypertrophic cardiomyopathies. So, in hypertrophic cardiomyopathy, um, looking at the clinical features is just like you trying to look at the signs and symptoms of a hypertrophic cardiomyopathy. So, if you had, this is a hypertrophic cardiomyopathy, like you have an abnormal thickening of a heart muscles. So, if there's an abnormal thickening of the heart muscles, the heart valves will be the ones to pay for it. So the heart valves will kind of like be narrowed. We see this one is affecting the left ventricle. It could also affect the right ventricle. Okay. So if there's abnormal thickening of heart muscles, the heart valves are what? Their space is now reduced. Okay. So what would be the signs and symptoms? How would the patient present to the clinic? Okay. So that patients with hypertrophic cardiomyopathies are often asymptomatic. That's what unfortunate, okay? And they are often identified incidentally during routine medical examination. Okay, they are often identified during routine medical examination. So, an abnormality on the ECG or through a family screening following the diagnosis in a first degree relative. Let me say they checked somebody in your family and they found out the person has what? Hypertrophic cardiomyopathy. So they're not like, wow, let's just check for all the family members. So that's how they get to find out. Because why is it asymptomatic? It is asymptomatic because your heart muscles are thickened, but every other thing in the heart is functioning. So that means the heart is still pumping blood normally and all that. You get. So but sometimes some symptoms may be recognized. And this is mostly in people that have advanced hypertrophic cardiomyopathy, like they'll be having fatigue and breathlessness, and this is due to what? Impaired diastolic filling and decreased cardiac output. Okay, so it could be that the thing has become too large that the blood coming into the heart is very small, so the blood pumped into circulation is very small. Okay, so you just start feeling very tired. Okay, and okay, we're having problems trying to breathe. Then symptoms typically deteriorate. Okay, that's as the disease condition goes on. Like if the disease condition is left there for a very long time, the symptoms will be getting worse and worse. Okay, so also they might be having chest pain, which may result from increased cardiac work, secondary to what? Left ventricular hypertrophy. So the left ventricle is kind of like the space is small, okay? So the blood pump into circulation is now small. So the left ventricle has to do what? Extra work. Let me say if usually if it's pump one, it will do. It has to now pump twice in one. Okay. So there could be angina due to that, and there could be a relative blood supply demand mismatch. So the blood supply to your tissues is not being sufficient. Okay, and there's also narrowing of intramural arterioles. Okay, high diastolic pressures increases what the diastolic wall stress and impair the diastolic coronary blood flow. Then, as it advancing, okay, the patient might be experiencing what? Palpitations, pre-syncope, on syncope, that's what? Fainting, right? And may also occur due to what? Arterial and ventricular arrhythmias, okay? Or mechanical obstruction to the cardiac output in those patients with left ventricle outflow pressure gradient, okay? The sudden death may also just occur. Could be that your tissues are now continuously being starved of oxygen, and the person just suddenly dies like that. Then progressive left ventricular dilatation and failure, and this is due to what? An ongoing myocardial fibrosis and chronic small vessel ischemia, right? Progressive left ventricular dilatation and failure. So that's it for the clinical features of what? Hypertrophic cardiomyopathy. So that's you just trying to look at the signs and symptoms all together for this what? Heart problem.